Hello everyone, how are you today? I hope you are all healthy and fine there. Okay, let me introduce myself. My name is Ardhita Putri from Nursing Study Program University Muhammadiyah of Ponorogo. I made this video to complete my final English assignment and get to the topic. Now I will to explain pain insertion form. But first, I hope you can understand what I'm trying to say. So, get to the topic. First is, what is a pain assessment form? Pain assessment form is a health form that contains patient pain inside. Pain assessment form are used for recording and assessing pain in patients. There are some internal aspects such as intensity of pain, the location of pain, the factor that add weight and relief of to the pain, and the effect on the patient. Next is, what is the pain assessment like? Like the accompanying picture, pain assessment form is made up of 10 rows. The first row is containing patient personal identity, like of name, age, and address. The second row contains the pain medication patient use. The third row contains the patient pain. The fourth row contains pain cause according to the patient. The fifth row contains how painful patient feels. The sixth row contains the intensity of the patient pain. The seventh row contains the frequency of the pain. The eighth row contains how patient feel of pain. There are 6 aspects in it. There are something that makes pain better or worse, pain-related symptoms, day or night bending of pain, something that control pain in the past, and the last one does pain prevent the patient from active. Next is the 9th row is contain the date of inspection, and the last row is contain the signature of assessor. So how do we fill out this form? To fill out this form, we could ask the patient some question. Next, I will give you an example. Hopefully, it is help. So first, for personal detail or personal identity the patient. So how do we get to the patient identity? There are 3 ways we can get it. First, when patient reside at a hospital. Second is a patient medical history book, and the last one is can be asked the patient at the checkup. So next is for second row, it's for pain medication our patient use. For that, we can ask the patient with question like, did you make any medication for your pain? And after that, don't forget to ask for the dosage and side impact patient are feeling. For this, we can ask the patient like, how many do you take and what do you feel after taking the medication? So next is move to third row for side of patient pain. For this, we can ask the patient to show us where the pain is. So we can ask the patient like, show me where the pain is, or point at the pain you feel. So for fourth row, how do we get to the patient to describe the cause of the pain? So for this, we can force patient to describe the cause, because not all of patient don't know and understand the cause of her pain. So we can ask the patient like, do you know the cause of your pain, or why do you feel like that? Okay, next is about how painful patient feels. We can ask like this, like, what is the pain like, or is it sharp, dull, stabbing, or itching? Okay, next. The next is about intensity of the pain. For this, we can either observe or ask the patient like, on a scale of 0 until 5, with 5 being the worst, how would you rate what you feel right now? Okay, this scale has a meaning. For 0, that means no pain. For 1, that's mean mild pain. Usually, the patient will feel gnawing, gnashing, pinching, and thick pinching. 2 scale, that means discomforting pain. The patient will feel troublesome, nausea, pressing, numb, and crawling. 3 scale, that means distressing pain. Usually the patient will feel miserable, agonizing, gnawing, draining, crawl. Okay, on this scale, the pain has begun to increase. 4 scale, that means horrible pain. The patient can feel intense, dreadful, creeping, and squeezing, viscous. And the last one is 5 scale, that means excruciating pain. And usually the patient can feel unbearable, torturing, crushing, tearing, and killing. So it is the height of pain that patient has been unable to cope with the patient. So move to frequency of pain. We can ask the patient like, how often do you feel the pain, or is it occasional, frequent, or constant? Okay. Next one is about patient view of pain. It can be seen on our form that we can turn in into a direct question to the patient. So I give you an example like, what makes you pain better or worse? Next is, what do you do to control the pain before seeing a doctor? So that is, and for the other question you can look at the form. Okay, the next is for the last row can be filled based on the days when we do the check on the patient, and the last one is about your signature. Okay, so I think this is all I can say. So that is for me. I hope you guys can understand what I'm trying to say, and thank you very much. I hope you guys enjoyed this video, and bye bye.